Hello, this is Dr. Katie from Craig Chiropractic and Kinesiology, and today I wanted to talk a little bit about low back pain. Now, specifically, I want to talk about what I kind of refer to loosely as mystery low back pain. So let's define what that is really quick. Now, with traditional low back pain, that is where obviously you have pain in your back, and commonly there is a known cause. Okay, like some dramatic examples would be like a car accident or you fell off your bike. That is a known cause, right? It could be something less dramatic as that. It could just be that you lifted a box that was too heavy, you shoveled snow, you sat for too long, things like that. But it has a very clear cause and effect, right? You did something that caused injury. I lifted an object that was too heavy. I fell down a staircase. These are all very, very obvious cause and effect situations, right? They make sense to us as humans of, okay, this is why it hurts. And then as chiropractors and health practitioners, we strive to help you, adjust back to where your back should be and help with pain management and quality of life. And there is a lot we can do to help with back pain. Now, today, I'm not going to talk about that type of back pain. That is more of your common categories. In future videos, I may cover those. But today, I want to cover what, again, I call mystery back pain. So what exactly is mystery back pain? Now, this is just a term that I use loosely. I don't know if anyone else really uses this one, but I refer to this as back pain where there is not an obvious cause. Now, here's an example. Let's say that you're a fairly healthy person, you don't have back pain at this moment, you're doing okay, and then you go to do something. Let's say a tissue falls on the floor, and all you do is you just bend over to pick up the tissue, and suddenly your back just locks up. It's like, whoa, where did that come from? Like, you didn't see that coming, you didn't have any warning signs or issues before that, it's just all you know is you went to do something very easy, very light, and suddenly your back locks up. It's like, what is this? Maybe you've experienced this yourself or you know somebody that has. And yes, this is more common than you would think. And again, I put that in the category of, again, quote unquote mystery. Everything always has a cause, but the cause in this case is not as obvious. It's like, well, what did the person do? They are quote unquote doing fine. They bend over to just grab something light and it's like their whole back just locks up. Okay, in this situation, we have to look a little bit deeper since the cause of injury is not so obvious, right? They didn't fall off their car or something like that, right? Nothing dramatic here. And sometimes people joke like, it's pathetic. I should be able to just lift this tiny box off the couch. That's not heavy at all. So where do I start looking at this? As a chiropractor, I want to consider several things. If we don't have a known cause of injury, the next thing I'm going to ask questions about is actually your digestion. So how did I get from low back pain to digestion? Great question. I'm going to switch over to a chart and I want to show you. All right, so we're going to be over here. If you've seen any of my previous videos, you remember these models. So let's go ahead. We have several different muscles here. So let's look at the low back. So we know low back pain is all down here. We have so many different layers of muscles. Here's your lat. Underneath, we'll see there's QL down here. We come to the front, we have your main, core, and abs, okay? These are all very important for proper back biomechanics and to prevent back pain, okay? So I always tell my patients, you need the front muscles working just as much as the back muscles. Now, something interesting to note is that all of these muscles in your core and abs are all closely related to digestion. Okay, so I would start by asking the person, hey, do you have any digestive issues? Now, sometimes it's obvious. They're like, yeah, it's weird. I've just started getting diarrhea this past week, or suddenly I'm constipated. Sometimes these are chronic issues. Sometimes the patient isn't even aware of issues that they have. So here's some examples. Having the diarrhea or the runs. I would call that a digestive problem, okay? Constipation. Now, my definition of constipation, if you are not even pooping, I know, fun thing to talk about, if you're not pooping or having a bowel movement at least 1 time per day, you are constipated. If you're going 3 days without being able to have a healthy bowel movement, that's constipation, okay? That means that things are not detoxing properly. We have problems. You're dealing with things like excessive gassiness, bloatedness, abdominal discomfort. These are all things to consider. And many times, these mystery back pain cases are actually related to digestion. Okay, we're going back to our chart. So think about it. All your intestines are in here. If they are inflamed, if they are irritated, those are the muscles that they are going to be impacting in the front and in the core. If your core muscles are not working, I always call your core muscles kind of like your personal back belt. This is what helps protect you when you're lifting. When people have back pain, everybody goes right back here to the back. Everyone's like, oh, these muscles are so tight, dig these out. But if we don't look at the front, you can spend all day long looking at the back and you're not going to get to the problem. Because if these are inflamed, if these are ticked off, if these are not engaging properly, which I would say in most average Americans, they are not, we're all guilty of it. If these are not working properly, they cannot help protect or engage your back. So these actually go weak, they're not engaged. And this is more than just you haven't done enough sit-ups at the gym. This is actually they're not biomechanically firing properly. Okay, because of the inflammation and what's going on in the gut. So, long story short, to bring it in, if the abs are not working properly, a lot of times the low back will lock up to protect the low back. If you're going to do a lift, you're going to lift something up, you need everything working. You need front engaged as well as back engaged. So you can squat, you can lift, you can bend. If the front is not working properly, meaning those abs and core cannot just engage, even on a basic level. We're not talking a 6-pack here, just basic engagement. If you can't do that, your low back has to pick up the slack, okay? All muscles should be working balanced all the way around. If they're not, if the front's not working, that means my back has to work double time. So now a seemingly innocently light task, like picking up a tissue off the floor, now is harder because the muscles are not balanced properly. So your back doesn't want to get overstretched or injured. So to protect itself, your low back actually seizes up because it doesn't want to get overstretched, pulled, or injured. So it locks up. So this is where with a lot of back pain cases, we actually see these muscles in these groups, particularly the QL down here, or quadratus lumborum, will actually lock super tight. And people will dig and dig and dig and get massages on these all day long, but they won't loosen up until we address the front. If we can get the front working, these go from weak to engaging so that they can engage, then we can start working to loosen these up and to balance. We need both. Now the next logical question is okay, let's say those front abdominal muscles are not working. Well, how can we help those? Some of the number one things that cause those abdominal muscles not to work include gut dysbiosis. This is where the microbes, that includes things like bacteria, viruses, parasites, etc., that are supposed to be in your gut, are at an unhealthy level. I always try to tell my patients that you should have a good ratio in your gut, where I would say good microbes, right? The good bugs versus bad bugs. You want more of the good and less of the bad. If you get more of the bad ones and less of the good ones, we have problems. That is gut dysbiosis. That can be caused by stress, eating bad foods, exposure to bad microbes, you name it. There's many ways. So, gut dysbiosis is a major cause for gut inflammation, which in turn can cause those core abdominal muscles not to fire properly, which leaves you more at risk for low back pain. Isn't that fun how that all works? You know, other things that are important. Also, along with that, so we have gut dysbiosis, food sensitivities, okay? So there's different types of sensitivities. There are sensitivities that you have more like your whole life, like somebody with a severe peanut allergy. If you were gonna eat a peanut, your gut would get inflamed, right? In the reverse of that, sometimes we have where the gut's already inflamed by like a bad microbe, a parasite, something, it's inflamed. So now the gut almost can't cope with certain foods that shouldn't bother it. suddenly it now reacts to them and just becomes more angry and more inflamed. And the more inflamed the gut is, the more problems we have, including predisposing you to back pain. So gut inflammation can either predispose you to low back pain because it weakens things and you're more at risk of injury, or gut inflammation itself can actually cause your back pain because everything is inflamed, there's pressure, it's pushing where it shouldn't be. So see how that just got more complicated? So many of our mystery low back pain cases are actually gut health problems. So it means we need to address your gut to help your back. All right, well, thank you for listening, guys. If you have any questions about that, please drop them below and stay tuned for next time. Thank you.